Hi, my name is Dr. Robert Watson. I'm a chiropractor with Community Healthcare System. I hold my doctorate in chiropractic and my master's in sports rehabilitation. I did my rotations with Scott Air Force Base through the military. So to kind of answer that question, I kind of have to tease those apart just a little bit because different diagnoses will receive different treatments. So back and neck pain, first off, are the leading cause of missed work here in America, second only to the common cold. It is also the leading cause of people having to leave the workforce early, so people going into retirement early. Treatment for back pain is complex because everything in the back is actually really small and very closely interwoven. So what feels like joint pain could be more muscle pain, or could be caused by a disc issue, or even sometimes your internal organs. So kidney pain is a really good example. It hurts in the back. So many nerves actually innervate different things. So sometimes the pain is referred to other places. So there are more obvious treatments for back pain like rest, heat, ice, physical therapy, pain management, and even sometimes surgery. But now the hospital is actually able to offer other conservative approaches before we get to these surgical options. One I'm going to talk about is called Cox Flexion distraction. So the research on this technique was pioneered by Dr. James Cox of National University and Loyola Medical School. And it demonstrated the outcome for patients undergoing this procedure to be pretty similar to the outcomes that would have been done if the patient were to go through surgery. So these patients followed up and were asked how their pain levels were. The results were very similar if they went through Cox Flexion distraction or if they went through a surgical intervention. Cox Flexion distraction is actually a specialty within chiropractic, where the physician is able to actually have the patient lay on the Cox Flexion distraction table, usually face down, and can apply a targeted distraction to the spine. This way we can actually target a specific segment where we know the disc pathology actually is. So with our distraction, instead of having like some sort of a shotgun type of approach, what this does is it actually drops pressure inside of the disc. So when they performed the research in this particular event, they found the pressure inside of the disc actually dropped so much that it became negative, meaning that it created some negative pressure inside of the disc and actually even gave the patient back some disc height and increased disc space within the spine. So when we talk about a disc, it's actually important to understand why disc herniations are a bad thing to have in the first place. So discs are innervated, so when they do become damaged, the patient will feel pain even if they don't have sciatica. Now, if the disc were to protrude or herniate, it could actually come in contact with one of the nerves, and once it does, that's going to create numbness, tingling, or even shooting pain that goes into the lower extremities. So with this technique, the table allows the doctor to place the patient into whatever position that they need to be in order to move that disc away from the nerve that are bringing those symptoms down to the leg. This is called centralization. So when we have more pressure on the nerve, the farther down these symptoms are going to go into the leg. So this table can also help the doctor treat things that are like back pain even without sciatica. So the table does actually allow for the treatment of joints and even stretching of muscle. As I said earlier, back pain is kind of hard to treat because the anatomy of that area is so closely interwoven. So this table allows for the treatment of several different elements in the back. What sets this technique apart from other treatments is that it's actually a specialty within the profession. So this is still not taught in all chiropractic schools even today. So this treatment was invented by Dr. James Cox, who's actually a local doctor in Indiana. He resides over in Fort Wayne. What the research demonstrated was that a normal chiropractic adjustment, when applied to a disc, the forces inside of the disc were just too uncontrolled. We could not predict what was going to happen, even with several experienced chiropractors. This treatment has the most research backing it up as the gold standard treatment for disc ailments. Every disc herniation is different. So some patients will get better with extension, some with side glides, or some with flexion. This is why a lot of physical therapists will actually begin with extension. The best part of this table, though, is that it allows me to treat the patient into any of these positions. So it allows a good way for a patient to get manipulation done, even without the classic cracking sensation. Some patients love that feeling, but it does scare some patients. Most importantly, that classic cracking is also not appropriate for every patient. Some patients cannot go through it. This bridges the gap and allows everyone to be able to get some form of gentle manipulation on top of what it offers for disc treatments. And for these patients that want a classic adjustment, we can do that too.